Visual field test, single field analysis. The single field analysis includes the sensitivity levels of each point in decibels, an interpolated grayscale display, the total deviation in decibels, and probability of each point being normal in a non-interpolated grayscale, the pattern deviation in decibels, and probability of each point being normal in a non-interpolated grayscales, and the glaucoma hemifield analysis. The total deviation, compare the result to an age-matched normal populations and states the probability of each point being abnormal on a point-by-point basis. Pattern deviations, compare the result to an age-matched normal population corrected for the overall level of sensitivity for the individual. The probability of any point varying from this level is stated on a point-by-point basis. This enhances the ability to observe mappable scotoma within a generalized depression, which may be induced by small pupil or poor macula. If there are no abnormal points on the total deviations and pattern deviation plots, then the patients can be considered as having a normal field. A generalized depressions will be most easily appreciated by looking for majority of abnormal points on the total deviations probability chart. Classes of two or more non-age points together on the pattern deviation chart should be considered suspicious. An isolated point within the central 10 degrees should be considered suspicious. If a cluster of abnormal points exists, it should be interpreted with respect to its underlying anatomical correlated and subsequent clinical significance. Many artifacts show large jumps in sensitivity from -1 to -28 diopter decibel, for example. The glaucoma hemifield test analysis the relative symmetry of 5 predetermined areas in the superior and inferior field, as well as judging the overall level of sensitivity compared to age-matched normal values. The visual field is then classified as being within normal limits, outside normal limits, borderline, abnormal high sensitivity, or to have a general reduction of sensitivity. Note that some other visual defects are not picked up by glaucoma hemifield test, so it should not be relied upon to interpret all visual field losses. The defect curve ranks the test locations from most to least sensitivity and plots relative to the 5% and 95% confidence interval for normal visual field.